So, good evening, everyone. Good evening, everyone. How are you?
Good evening, sir.
Okay. So, how was the day? Namaste,
Fine,
madam.
sir. Very good.
Yeah.
Namaste, sir.
Nice to see you. Nice to see you. Huh?
Thank you. Thank you.
Okay. So, how is the rainfall and all there in Bangalore?
Yeah, we get, sir. Often we are getting.
Okay. So, it's a very good climate then. Huh? Enjoying.
Yes. Yeah. Enjoying.
Okay. Very nice. So, shall we start the program? Okay. So, you're ready? So, most
Yes,
of
sir.
the 18 members are here now. So,
Yeah.
today, as you know, we are speaking regarding the concept of the Nadi parikasha. That is one thing related to the machine, and one above that, and how whether there is any difference between the machines and the way we perceive the things. See, most of the time, what will happen? We have given our brain to the hands of the machine. If the same way, if you continue, we will be a slave of a machine. So because many a times machine is a machine itself, it is not able to understand our emotions. So I have been asking few people, those who are been using the machine, like, I will tell the regarding how many types of machines are there, the cost and everything. So what's the technology is being used in all those things. So fine, they are doing a very good job. Definitely, I really salute them. Okay, but still, we should understand the concept, and then only the machine might be helpful. Without knowing anything, simply taking the machine and having a diagnosis will not give you any good thing at all. So, shall we start? Okay, now coming to the slides. So, are you able to see my screen?
No, sir.
Now, are you able to see my screen?
Yeah. Yes.
Okay, right. Okay, fine. Sure. So now let us start. So observe the nature. So if you observe the nature, there is one, climate condition. There is weather forecast for 7 days, 14 days. Do you know how the technology works? So there will be definitely stored data. That is, this year, this date, what was the climatic condition? So many data there, it will be stored. And based on the climatic condition now, what is the temperature? What is the humidity? So what is the ratio of the wind flow? So based on that, there is a calculation is made, and henceforth they are going to predict this could be the nature of the climate in future coming 7 days. So why it is not possible for a human being? Only after getting an attack, if you are able to diagnose it's a heart problem. So then what is the use actually? So before to that, if we are not able to understand, at least by 6 to 7 months, by at least, if it is not possible, then what is the point in diagnosing itself? So each and everyone can tell after having a heart attack. A layman can also tell this is a heart attack. Why doctors we need actually? So before to that, if you are able to predict, if you are able to say, and if you are able to stop something, then it will be very much useful. So only I am telling that weather forecast has been doing in that way by taking the data. So what nature of the by understanding the studying of the nature, the wind, humidity, temperature, why it is not possible for us? So you cannot assess anything in your naked eye. So when I only see through the microscope, then only I will admit this is a virus. So before to attack of a virus, there is a certain body body acceptance to the virus. That is, when the immune system are going weak, we should be able to tell, see, this is the problem for you. So what you could do to improve your immune system? So most of the way we go for immunosuppressive agents, just like cetirizine, okay, steroids. If at all, if you get an allergic or allergic rhinitis, bronchitis, asthma, each and every time, usually what will happen, if for example, if a patient encountered with an asthma, we go for an antibiotics, derifilin, and also some steroids along with that. Initially, what will happen, whatever the phlegm which has been collected, that will go off by giving bronchodilators and all. But later on, I have found in my clinical experience that after all, due to the side effect of the medicine, the lungs alveolar sac goes on shrinking down. Henceforth, the person who has been encountered once in his lifetime asthma, he will be an asthma patient forever. Why it is so? Actually, we are being drugged in an overdose fashion. So for a temporary basis, it works. Definitely, I agree. For an emergency cases, it will work 100%. I agree. But why do you use for that long time? You should have a sense that if you take on for a long time, it works on the receptors in the bronchus. So what will happen, each and every time bronchodilation will be there when you give derifilin, salbutamol and all. So what will happen, the receptor it's an elastic in nature, where it get dilated. After a time, it get just collapsed. Just our elastic waves. If we keep on stretching every day, what will happen? It will be soon collapsing. In the same way, that collapsing nature has been encountered in the asthma patients. This is just one example I am giving, where really we are being drugged and we are telling that it is a disease. Actually, it is not a disease at all, because we are creating a disease. Absolutely, have treated n number of cases where within a week that will get vanished in an initial stage. And if at all, if they're drugged for many days, then it will be a permanent for them, because they are being getting addicted to the medicines. So medicine should act just like a lighter, not like a big, big flame where it will destroy all our system nature itself. So definitely we should require an allergy. Allergy is an immune response. Why we are just suppressing it? So we should see what is wrong, what made the body to sense it as an allergen. So what is the cause? If we understand the Nadi, we can understand one thing. That beautiful thing is that pitta, that is the middle finger, wherever you feel your pitta Nadi, okay, middle finger over this pulse, whenever you feel that it is low, it is not up to the mark, you're not feeling it's very low, it's very manda, a small shape. You can understand that when pitta is not secure enough in the stomach, what will happen? The kapha part will get increased. It's something like whenever there is just imagine. Yeah, you want to tell something, Sukresh? You want to speak anything? You can speak. Yeah, you just raise your hand.
Sorry.
Yeah, it's okay.
Sorry, that was pressed by error. Yeah.
It's okay, no problem. So what will happen if you feel low? See, you can just imagine a climate. You have been into an Jammu and Kashmir, where it's very much cold. So what will happen? Usually you feel to drink hot coffee, hot water, hot things, right? So there is an intuition how to stay away from the cold, how to maintain our body. In the same way, whenever pitta is being really decreased, when there is no appetite, when there is no absorption and assimilation, at that part, whatever you take, that is kapha kara ahara vihara, that is, we take heavy food, heavy meals, so which will be converted into the kapha itself. So what will happen? Each and every cell will start oozing rhinitis. Actually, that is the process. And now it's not because of really an allergen. Allergen is a just a lightning factor. That's it. It was a kindling factor. That's it. It is not the real factor at all. Why? If so, if it was a real factor, all should get rhinitis who stays near the pollen grains for that or this. So if it is not like that, then something mistakes in your body and not with the pathogen or allergen outside your body. So I will tell you, and I will keep on stressing you, for each and every disease, we are responsible, not the virus, not the bacteria, not the allergen. I will be able to substantiate this also, because if corona has come, it might have ruined all the human beings. By if you are getting they're like just like a normal person, if you are getting, if you are dying, why? This is because it's because of our own immune system disturbance, not because of the virus. Simply we are afraid of virus unnecessarily. Okay, so coming to the point. So when pitta is low, now you have to understand, pitta means it's a heat. Kapha you can compare to a cold climate or cold thing. Okay, now when heat is low, what will happen? Kapha automatically, that is cold, will cover up the heat. Henceforth, each and every cell starts exudating. That is the nature. What we will do at that time, we keep ourselves hot. We take a little bit of hot things like pepper, cardamom, and a few things which will be able to, so that we'll be able to compact that coldness or dampness. So this is, we have got an inquisitiveness. What we are doing in nowadays, we have left all those things, straight away going for an injections, avil, cetirizine, all those things, where we are suppressing our immune system. Then how you would like to tell that how we will be able to fight an virus or an infection? So we are almost have the opportunistic infection. Getting the point? So observe the nature, and we have to understand few things, where at least observe our body, observe our Nadi, so that at least we'll be able to understand, have some thoughts, what is going to happen at least in 7 days. You need not to predict up to 7 months. That is done by great Nadi Vaidyas. So really it is, everything is possible, but definitely at least I am telling you, have a little bit of knowledge such that you yourself will be able to understand what is your problem. So what I can do in my own kitchen, you need not study complete of Ayurveda. Ayurveda is in your kitchen itself. Ayurveda has been evolved in our Indian system of medicine. By knowingly or unknowingly, we are all practicing Ayurveda itself. Say how? Okay, I will tell you one best example. So you might have seen people wearing few thread here in the armpit. Okay, so initially I was thinking why they used to wear that. So when I studied Marmam, I understood that that is one Varmam which used to strengthen our arms. So if you tie that, whatever the pain, it will move. How to stimulate it? It's a Varmam point. So press like this, 1, 2, 3. This is called as Kauli Varmam. Called as Kauli Varmam. So what if you do in that way, the hand get energized. So in the same way, if a thread is being tied over here, it keeps on giving a small compression, a small, whenever you move your hand, it gives a small compression over that point. Henceforth, you might see that person will have more energy. So henceforth, you might see whenever the Kusti Patus go to fighting, they do like this. It's called as Tattu Varma. And they the inside of the thigh also they do like that also. So to initiate that Varmam, that is the vital air has been occupied that space. If you energize that part of the air by Tattu Varmam, what will happen? It will get strengthened. Why it will get strengthened means you are taking a little bit of vayu in your hand. You are beating, not beating in this way. You have to cup like this and you have to beat like this. Some will beat like this. No, this will harm. This will only be strengthened. So you are taking little bit of vayu, and when you are energizing that part of your vayu inside your system, what will happen? That will get increased. So you get strength in your body. Getting the point? So these are the few things. So today one patient came where actually 2 weeks back I had shared you in my WhatsApp group Marmakalai and Nadi, where one person, that lady has completely bent down and she was not able to stand straight at all. This is the third visit where she is telling from first visit she was okay. Now she's second also I told she came, and today she did not come from for the back problem at all. That is completely be cured. She was telling about some lump over the thighs. So I am telling you is that if you are able to correct the system of our spine and vertebra and remove the block, that becomes very easy job. Or else what will happen if you rely upon the medicines? What will happen? We have keep on relying on the medicines, where medicines are just like temporary. What we are doing, we are giving painkillers. Ayurveda doctors, what they do? They tell that, so we are giving, they're treating the disease by the root, but still they have got an allopathic doctor mindset. Why? Because the allopathy system has been influenced all the system of medicine. So what happens? They give Amrutottara Kashaya, Rasta Saptaka Kashaya, Trayodashanga Gugulu, and all the things where vata has to be decreased. Okay, that is fine. But we keep in a massive dose where what will happen? Complete vata shamana will take place. Please note this point. If complete vata shamana is going to take place, the healing effect will not be there. Pain might reduce. Okay, fine. But the complete healing is being inhibited, that is stopped, because I will tell you one thing. See, vata is the energy that is passing all over the body. So whenever you do the vata shamana, the vata slowly starts regressing. What you have to do? Remove the block so that vata might travel all over the body. That is complete curing. So only in Ayurveda it is being told, Kha vaigunyat vyadihi upajayate. That is, where there is a block, their manifestation of disease takes place. So we are not understanding. So Ayurveda doctors have got many tools. Marma Chikitsa, it's a beautiful tool. We are not using because we are not taught about it. So henceforth, Marmam and Nadi, these are the most essential things that has to be learned by each and every doctors to understand, because no doctors will have the sophisticated X-ray, MRI, CT, angiogram, all those things. If you are practicing in a rural area like me, so you have to rely on the Nadi, where absolutely you will be able to get the point. You need not have ECG, MRI, X-ray, anything. Without that, you will be able to assure, you will be able to diagnose or differential diagnose, and you will be able to tell the patient, change the things, whatever you are doing till now. See, whenever you have acquired a disease, it means that because of the wrongdoing. Okay, just by giving some tablet, it will reduce the symptoms. That's it, but not the actual disease. Now, what you have to do? You have to undo the wrong things. That is, we call it as nidana parivarjana. Whatever the things you are been doing till now, you have to undo the things, and you have to give a positive way of life. That is the way of position of sleep, which I explained you, how to sleep, how to control the manas, sattva vajaya chikitsa, how we have to take the food. So that I will be telling in one more section, what is the nature of food and all everything. But definitely there is a point called as satmya, so which we have been accustomed to a certain food. So it has to be looked into it, and the food has to be given. That is what food? The food which is very light to digest. So when you understood that pitta is weak, which is causing a disease, it means that if you want to increase the pitta, what you have to do? Give light food, so that body has to sustain with the trauma. When you give light food and give little bit of medicines or do varmam to remove the block, definitely your problem will be solved. Or else if the patient is taking biryani, heavy food, what will happen? Whatever you do, Varmam, or any manipulation techniques or whatever the medicine you give, it will not work, because whatever he takes, apatyahara, that is very heavy to digest, that is kapha is formed. The formed kapha, further it will block the channels. So that will cause another problem where you will not get a result at all. So if at all, if you want to get good result, you have to convince the patient. So you are here because of your wrongdoing, not because of any doctors, only because of you. So now you have to do, if you have to correct yourself, if you agree to obey all my things, what I will be able to tell, then you will be okay. So it happened yesterday, one patient had come from Bangalore, where that is a second follow-up. Actually, he has been taking 12 tablets, 4 for sugar and 4 for BP, insulin also along with that. So he was not able to walk 10 steps also. He used to get nausea, vomiting, everything. So even though, in spite of taking so many of tablets, what happened? The sugar level and BP level was not at all under control. It was 180 by 110. Sugar was 300. All this was there. So slowly, ascites like feeling has been developed. So what happened? I asked him to stop all the medicines and asked him all the, like, I have done drawn marmam acupuncture and have said the food how to take and all. So by that, what happened means, he, on the second day itself, he was able to walk, he was able to work from morning till evening. And now when I have, yesterday he had come to me, when I checked his blood sugar and BP, it was quite normal itself. His BP was around about 150/90. Okay, still no problem at all, without any medicines. So he sustained to come back without going for a renal failure. So what does it mean actually? Medicine, it's not curing anything, it is destroying our body cells. So it's definitely used in an emergency. But whether you have to ask one more question, is the daily is an emergency? That is a point. So on the case of emergency, where you get a stroke and where you have to reduce your BP, definitely you take for how? 1-2 days, fine. But every day taking will destroy your capacity of receptors. It will destroy your receptors. Henceforth, definitely you will have more side effect than the good thing. Now you have to understand one thing. What is the Nadi tarangini device gives us? So there are many devices costing from 25 to 28,000 to 15 lakhs. Japan made, Australian made, okay, Indian made, like the Nadi tarangini, Nadi swara. So many things you get. You can just search for that. The thing is that all the machines have been evolved from the same concept, whatever I am teaching you. I strongly suggest that without learning Nadi properly, without understanding the Pancha Mahabhuta, without understanding Vata, Pitta, Kapha, their utility, don't please purchase all these machine, because machine is a machine. So whenever you feel and whenever you tell the patient, this is the thought process that is going in your mind, the reliability of the patient towards you will be very much high. The trust towards you will be very high. Or else what will happen? Many a times I have asked a few practitioners, those who practice with Nadi devices, I asked them, so it will be very problematic to handle a patient. Every time they tell that you do that and what the report says. Many times what will happen, patient is been recovered and Nadi machine is showing it's not being getting recovered. You need that and this. If you check within half an hour, you leave for half an hour and you check, there will be a great difference. Why this happens? Because the machine is a machine where it is not able to understand the emotion, whatever it's going inside. It takes the wave and tells this is the problem. So we cannot rely on a machine, because when you understand, one lady had come of 19 to 20 years. So she was really suffering from asthma. And I told her, so you have fallen in love. So there is many, because that made her the wrong emotions, where all the family has been telling that don't go without their consent. She has been she has gone into that affair. So what happened? So prajna parada, that is knowingly doing something wrong, that creates sarva dosha prakopanam. First thing what will happen, pitta will go down. Initially, you need not take heavy food, you need not do anything. Just by thinking, when you change the perspective of thinking, the pitta will go down. Whenever you go to in a depression thought, the pitta will go down. What will happen when pitta goes down? Tell me. Kapha will dominate. When kapha has dominated, luckily she got what? Asthma. So that is the problem actually. So now what? I told her, this is the problem. So better you have a clarity over that. So fine. Later on, she left that and that problem was completely cured. Why I am telling you? Because let us not look into the disease. Disease could be the manifestation of the thought process. Looking into the thought process, if you are able to find what thought process made the disease, then definitely you will be able to understand and you will be able to relieve that. So when you are able to diagnose properly, definitely, then whatever the medicine you give, it works. Say why? Because if you are telling a girl that so love affair itself is a problem, it's creating a havoc, settle down, have a cool thinking, don't get agitated, and have a peace mind, go for a move, that will be a good. So when you give the suggestion itself, when she understands that, it means that definitely restoration of pitta is taking place, and definitely if pitta has been restored, body knows how to cure it. Getting the point? So these are the few interpretation of the nadi, how the nadi is being felt in the fingers. So you might see manduka gati, there is khaka gati, chitira gati, lava gati. So there are many things. I think in this class we will not be able to deal all the waves and their applications. So we need, in further class I will be telling that. Just for your glance, how the waves will be and what it means. So I'll be sharing the slides also. You can just go through that. Don't worry, I'll be explaining in future class. So if vata entering in 7 levels, how the disease starts? So in first level, what happens? Vata starts accumulating in lower abdomen, by which starts emaciation, that is rukshana, that is weak, drying up. So the patient gets constipation and all. In the second level, what will happen? Straining for a few days may leading to further aggravation of vata. So the patient might get addicted to laxatives. Okay, third level, vata enters sira and snayu. Calcium is not absorbed from the intestine. So many people complaining of body pain, joint pain when they work little, leading to sandhivata, just like osteoporotic symptoms. So at this time, if you take calcium tablet, that will, what will happen? Further drying up of water, leading to the further constipation. Piles also will take place. So without understanding the nadi, if you give any medicine, that could be wrong. So henceforth, learning nadi itself is a learning how we are, what is the nature of mind. So definitely I request each and every every practitioners to at least have few knowledge relating to the nadi. So fourth level, vata enters rasa dhatu, that is 7 dhatus. I told you, right? There is 7 dhatu. When vata enters rasa dhatu, what will happen? We have got only just 10 minutes. After the 10 minutes, we will be able to enter into the discussion group. So whatever the queries, if you are having, you can just ask with me in that group. I have sent you one more link, right? So what happens? The shoshan of the nutrients will take place. Intolerance towards this sound, that is shabda asaishnutvam. That is, if you go to a party, you will be very much irritated. I don't feel a noise or a sound pollution. I don't enjoy with the children's because their voice itself irritates me. all these things, intolerance, most of the times what will happen? This will lead to a disturbance in the disputes in the families. Okay, so we lose our tolerance, we lose our energy when rasa dhatu is being affected by vata. When fifth level, what happens? So enters rakta dhatu, digestion is upset, starts to eat. Whenever we feel low appetite, what will happen? When we feel low appetite, what will happen? We think that let us eat something tasty, pizza, burger, shawarma, that, this and everything. We consume a lot of unhealthy things, junk foods, and we think that we are okay. So that will increase further tamaguna, rajaguna in us, then further leading to the depression, loneliness, feeling that I may not recover from this. Now pitta, which is in the drava rupa vriddhi, that is pitta has got two parts. That is, one is agni and water. The water part will just keep on increasing. So only you get gastritis. Gastritis means it is not the increase of hydrochloric acid. No, the water content in hydrochloric has been increased. So what happens if you take Rantac? So whatever little bit hydrochloric acid was there, that will be completely exhausted. Only remnant is water. So water does not have any capacity to digest the nutrients. So henceforth, what will happen? What will happen? Anemia occurs. So you start anemia, later on disc prolapse, later on hyperlipidemia, cholesterol, BP, everything, gynecomastia, oligospermia. So you have started, now you understood that if you stop the stop the acid, hydrochloric acid by Rantac, 100% all the dhatus start decreasing up to oligospermia, up to the shukra level. That is, even the sperm count will go zero by the end of 15 to 20 days. So it's all experimented thing. It is, everything is in Sims book. Along with, you can just check, there is a thing called as adverse reaction, late reaction, immediate reaction. So actually it is being told in the book, it should be advised only for 3 days or 2 days. We are using just like medicine for years together. What is actually happening? We are not able to understand what the medicine, if you are not, for what we are taking, and how much it is disturbing us. And coming to the right hand pulse, that is have been showing you the how the waves of kama, krodha, lobha, moha, matsarya, okay, and guilt feeling, how this all will comes by an experience, observation. So only I keep telling you, feel the nadi, observe the nadi, make note of it, then only you will be able to appreciate the things. Just by seeing, definitely you will not be able to understand. In the same way, lust, what will be leading into failures, sufferings, all these things, you can just go through that. Few legs, immediately before to have the person going for a stroke, you get this wave where you feel it's very narrow and the beam of the waves will be touching here in this way. You feel a small string of water flowing and a few over here. That is heavy hypertension. It's going on in the place. All possibility for the rupture of the capillary is going to take place. So this is in my observation, whatever I am telling you. Hurting wave, pinching wave, what will there? If you keep a nadi over your left hand, kapha nadi, if you feel that something is coming and catching my thumb like this, so it means that we can ask the patient directly, you have been hurt by someone that is very much affecting you. That could be love failure, that could be something like the near and dear one which you have trusted the most has betrayed you. All these feelings create this a feeling of pinching wave, where you feel that as if something pinching and pulling your thumbs down. You feel a impression over here like this, and the wave come and hit and pull you like this. So this is a pinching wave. So whenever you have got an renal calculi in the left hand, the kapha nadi proportion, that is vata, pitta, kapha, this wave, you feel that something, a M type wave something is getting obstruction. So you'll be able to tell that there is a renal calculi. So based on the size, where if you get a small stone-like feeling, if you get, that is, you will be able to understand the size of the stone also. So that is based on pure experience, which you have to experience, then only that is possible. Okay, so coming to the point. So understanding Nadi, so many things are there. So definitely we are, I want to tell this point also. So now how to understand since how many days this disease have been started. So you should be able to tell the exact duration of months, exact time and date of the patient, since how many days you have been suffered from this disease. Is it possible without patient speaking anything? Yes, this is a calculation. If you understand this calculation properly, definitely you will be able to tell since how many days this disease was manifested. Even patient may tell you, sir, since only 5 days have been getting the problem, and you simply agree, you know something is telling it's not really possible. Definitely now if you feel the pulse and if you're able to get that, definitely you can challenge that patient. No, not at all possible. You have been suffered since 2 years, 6 months on January 26. Patient will be astonished. Hey, what? At actually the date of January 26. So it means that much accuracy we get by feeling that pulse when you master it. So in the same way, we can predict the future also. In how many days you will get heart attack, in how many days you will get stroke, in how many days you will get these problems. If you're able to understand these things, definitely that will help you not only to treat, not only to say, but to treat. So that is why I am telling you, activation time of manas is very much fast. So only I tell you, give the Sattvava Jaya Chikitsa rather than giving, if you are not giving any medicine also, at least give Sattvava Jaya Chikitsa, by which patient recovers instantly. So if rasa is being reduced, when there is an intolerance towards the sound and all, as I have told you, vata entering the rasa in 3rd level, it requires only just 15 minutes to get activated. Say how? So there is a negative thought process running in his mind, which is making the malabsorption. So whatever he has taken, the food which has to be absorbed from the body, that depends upon the nervous system. See, nervous system depends upon the waves of the manas. If the manas is in a tranquility, when it does not have any greed and kama, krodha, mada, matsarya, it absorbs whatever it is required. It absorbs the energy with whatever minimum food you have taken. Does not mean that you have to take all time rich nourishing food itself. If you take less nourishing food also, it has the ability to absorb whatever it is there in it. So it depends upon the nervous system, how much to absorb and how much to assimilate. So for this example, you can take, I think only we are left with only just 1 minute. So we will wind this program. So this section I will be telling in the next class. Okay. So thank you everyone for watching me, and your support made me to teach you, and you are my inspiration. So there are many great Nadi Vaidyas. Still you have been following me and supporting me. Thank you everyone, for each and everyone, for your sincere love and support. So thank you so much. So we shall meet shortly in a discussion section. Thank you. Have a good day.